Today I'm going to be speaking on juvenile arthritis, as promised last week. I wanted to touch a little bit on that so that people can fully understand what it entails, as it involves a lot of our children. So what is juvenile arthritis? Oh, my apologies. So this is something that a lot of us may not realize how much children are being impacted by this. Even in schools, you may notice children that are ambulating or having difficulty ambulating because their joints may be giving them a hard time. So let's have some definition to that. So what is juvenile arthritis? It's really also known as pediatric rheumatic disease, and it's the umbrella for this diagnosis term used to describe the inflammatory and rheumatic disease that develop in children under the age of 16. With JIA, the body's immune system mistakenly targets the synovium, the tissue that lines the inside of the joint, and the synovial fluid in the joint. This causes the synovium to make extra synovial fluid, which leads to swelling, pain, stiffness in the joints. So what are the signs and symptoms of this? They may have joint pain, swelling, high fever, stiffness, a rash, fatigue or tiredness, loss of appetite, inflammation of the eye, difficulty with daily living activities such as walking, dressing, and playing, poor weight gain, and slow growth. Symptoms may come and go over time. There may be times when symptoms get worse, known as flares, and times when symptoms get better, known as remission. So what are the different types? So you have the oligoarthritis, which affects fewer than 5 joints, most often in the knee, ankle, and elbow. Then you have the polyarthritis. This type of GIA affects 5 or more joints, often the same joints on each side of the body. Then you have the psoriatic arthritis. This type affects children who have arthritis and psoriasis. Psoriatic arthritis can also cause nail changes that look like dimpling or pitting. Then you have ethicitis-related arthritis. This type of arthritis often affects the spine, hips, and epiphysis, which is the points where tendons and ligaments attach to the bones, and occurs mainly in boys older than 7 years old. Then you have the systemic arthritis. Systemic JIA usually causes persistent high fever and rash, which most often appears on the trunk, arms, and legs when fever spikes. So the picture that I showed you earlier showed the child that had the rash to the chest. It can also affect internal organs such as the heart, liver, spleen, and lymph nodes. This type of JIA affects boys and girls equally and rarely affects the eyes. Then you have the undifferentiated arthritis. This is arthritis that also with symptoms of 2 or more JIA types that I listed above, or the symptoms might not match any type of the JIA. So how is it treated? They give non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids are also given, and what's called DMARDs. They're used to treat children with more severe arthritis that has not responded to other medications. Exercise, physical therapy, and occupational therapy can help to reduce the pain, maintain muscle tone, improve mobility, the ability to move, and prevent permanent handicaps. In some cases, splints or braces also may be used to help protect the joint as the child grows. Special accommodations with schools may be needed to adjust for children with limitations from their arthritis. Regular eye exam is important to find early eye changes from inflammation. Regular exercise, as I spoke about earlier, weight control, getting enough rest, learning to use large joints instead of small joints to move or carry things is also important. Let's talk about the causes of that. JIA is caused by several things. These include genes and the environment. This means the disease can run in families, but can also be triggered by exposure to certain things. JIA is linked to part of the gene called HLA antigen, or DR4. A person with this antigen may be more likely to have the disease. What are some of the complications? If it's not treated, JAA can lead to permanent damage to the joints, interfere with child's bones and growth, chronic long-term arthritis and disability, loss of function, vision problems, including loss of vision caused by uveitis, which is inflammation inside the eye, and inflammation of the membrane surrounding the heart. They can have pericarditis or lungs pleuritis in this systemic JIA. Are there support groups? There absolutely is. The Arthritis Foundation is a leading nonprofit organization that is dedicated to addressing the needs of not only the children, but also adults that are living with arthritis. There are more than 100 local offices throughout the US alone, plus those that are around the world. Many local and national events are organized to educate and connect patients and their family members. You can learn more about this at www.arthritis.org. Some information specific to children can be found at kidsgetarthritis2.org. A reminder, with early detection and treatment, including physical and occupational therapy, it is possible to achieve good control of arthritis, prevent joint damage, and allow normal to near normal function for most children that are living with JIA. The diagnosis I wanted to touch base on before I go any further, before I actually close off. There are many ways that doctors diagnose this, and these are two different tests that include labs and scans. They do C-reactive protein, creatinine, hematocrit, rheumatic factor. They do white blood cell counts, they do x-rays, and they do CAT scans. They also do urine tests. They may do joint aspiration, and this can be a little uncomfortable, but it's important as well. A small amount of the synovial fluid is taken from the joint and it is tested if crystals, bacteria, or viruses are present. And of course, a full eye exam is done by an ophthalmologist. I want to give special acknowledgement to Cleveland Clinic, the Mayo Clinic, arthritis.org for the information that I provided you this morning. I hope it was helpful. Should you have any questions, please join me in the Zoom. I'll be happy to answer those questions for you. God bless, thank you, and enjoy the rest of the service.